I'm Michael Hubbard. I'm an orthopedic surgeon in Hot Springs, Arkansas at National Park Medical Center. It's a minimally invasive approach where you don't cut any tendons or muscles. It's kind of a quick way to go right to the hip joint, and you can do it through a smaller incision. And generally the patients don't have a limp afterwards, and it's a generally fast recovery, according to patient dependent usually, but for the most part it's a quicker recovery and a smaller incision, and just a good way to do the hip. Ideal candidate would be somebody that's has hip arthritis, that comes to me, or hip pain and they don't know they have arthritis, or they come and they're just bone on bone arthritis. Typically what I see from them is that it's hard to get out of the car, put on a shoe, things like that they notice, and really just hard to move their hip. Or sometimes I see a younger person that has the bone that dies, and that's called avascular necrosis, but that's kind of few and far between. I think the overall benefit is that, like I talked about, you don't cut through tendons. It's really truly minimally invasive. It's more of a soft tissue procedure than a bony procedure, and patients get up quicker. So, again, patient dependent, but some say they have less pain. They can move quicker, and they like that smaller incision too. The pain that they're experiencing now with that hip arthritis or not being able to move their leg much, they will be very grateful probably within a week or two. Some patients even the day after surgery, they say, wow, that pain is gone. Of course, they'll still have the surgical pain, but the pain that they experienced before is gone. So I'd say, if you're ready to do it, we need to have a conversation about it, but I will never do surgery on someone until they tell me, hey, I'm ready to do surgery. So you're the one that has to convince me. I'm not going to convince you, basically. Again, patient dependent, but generally, you get up with therapy right away. If I do it early enough in the morning, the same day of surgery, you're up walking with a walker with physical therapy. But usually by 2 weeks, most of my patients are carrying their walkers in, and I don't need this anymore. Some people are like that right out of, I had one that the day of surgery just wanted to walk right out of the hospital, and she was ready to go without anything. So, patient dependent, but generally I've seen with this approach, it's a very, very fast recovery, and they get back to doing their daily life without pain.